Guys, welcome back to Medical Coding with Blue. Today's episode is all about risk adjustment coding for new medical coders. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So we need to go over this specific topic again. I got a comment that I'm going to read, and I'm going to read my responses as well. But I want to say this first. Anytime I'm giving you guys advice, especially in the title, when it says that I am just referring to new medical coders, veteran coders, when I'm talking to a specific audience, my nurses, okay? When I'm talking to a specific audience, I am talking to a specific audience. If I am telling you that I do not personally recommend that new medical coders stay in risk adjustment for a long time, there is a reason, and I always talk about that reason. But here's the thing, okay? What is risk adjustment coding? Back in the day, Medicare, knowing that they need to manage the funds into perpetuity, right? They have the Medicare Trust Fund to take care of, which means they have to be very careful with the amount of funds that's going out and all this healthcare that they're having to pay for. So what they decided to do was they decided to get some data collection going. And what they wanted to see was how much money is it going to cost if a person has this condition. And if they have a particular condition, then maybe they have another condition. Like maybe, for example, a patient who has diabetes may also have high cholesterol. And there's a lot of other conditions. But let's just go with high cholesterol for right now. Okay, so if Medicare was collecting all these diagnoses from all these patients that are being seen, and they saw a prevalence of high amounts of people who have diabetes and cholesterol, let's go ahead and try to get some educational programs going, some preventative care going to keep people from getting high cholesterol. So that way it's not so much money for us when we're trying to manage the Medicare funds. That's what Medicare is. That's a very plain way of putting it for the lay people to understand, right? It is tracking this information and gathering it by the diagnosis, so that way we know how much money is it going to be to take care of these patients into the future. Well, a lot of other insurances, because they always model themselves after Medicare, started to follow along because they saw the benefit of collecting this data. Okay, well, if this person is always getting into accidents, like, breaking bones and stuff like that, okay, well, let's try to figure out a way to get this data and collect this information and maybe come up with some other programs from there. Or what are we going to do to mitigate this risk? So there's a lot of things that can come out from getting this data, right? And so back in the day, like when I first started the channel in 2018, when I would see job ads for medical coders, they would post for risk adjustment coding. And you didn't even have to be certified back then, and this was in 2018. And so I would tell people, hey, you can even start in risk adjustment coding just to see if you even want to get into a medical coding career field before you do anything else, just to see, right? And people would either do it or they didn't do it. But the thing about being in risk adjustment coding is that it is just diagnosis coding. All you're doing is going through the records and picking up diagnosis codes so that the data analyzers can look at all of the data and they can make reports based on what they see, right? And so I have said since, though, that if you stay in risk adjustment for a long time, what happens is you're not going to be studying CPT. The vast majority of you won't be studying CPT, your modifiers, and all of that stuff will get forgotten because you haven't used it in quite some time. So I tell people risk adjustment is a great place to start if you're brand new, but do not stay there longer than 6 months. I've always said that. Make it a short stay, 3 months or 6 months, because you don't have to stay in your first coding position for a whole year. Some of you are putting arbitrary deadlines on yourselves, and it's foolish because Even when I first started, my first job was 3 months. My second job was 8 months. And then I was less than a year still of experience. And I finally got my job here at my forever home. So imposing these time limits on yourself, saying, oh, I'm going to be here for a year. You know what I mean? It's just no. And if you're saying, well, I don't want to show that I'm hopping around in job to job. Again, I had 1, 2, and then my third job within the first year. So that really doesn't matter. To me, that's just somebody that's thinking of excuses and not really wanting to move. You're excited that you got a job and then you want to stay there. So my thing is this: if you want to stay in risk adjustment, stay in risk adjustment. If you don't want to do anything besides that, you have your job, you're happy, this message does not pertain to you. Okay? This message does not pertain to you. Who I am talking to are the new people that are out there that are not really sure, and they don't really know, and they say, well, risk adjustment seems to be an easy place to get into. Well, because it's just data collection. That's all it is. It's just data collection. Okay? So again, I implore you, if you're going to start there, that's fine. But get for it what you're going to get from it, which is experience with the electronic health record, experience abstracting, which means pulling out diagnosis codes, and coding. Okay? But again, continue to look for your job that's going to get you experience coding for CPT and applying modifiers and evaluation and management. Get you a job that's going to give you that wide variety of experience instead of just keeping you in one thing, okay? And sometimes the production standards for HCC, I've heard, are quite unreasonable, okay? And I mean, that's just the worst thing that you can do to yourself when you're first starting out. Not every place is going to be bad, though. I've heard of some people say, well, I started in HCC, they treated me right, and, I was able to learn. It's everybody has a different situation. But what I'm recommending, though, and what I'm telling you guys is this: when I make a video and I say that this is for new medical coders, don't twist my words, because that's when I get upset, because I particularly craft a message the way that I'm saying it, and that's the audience who I'm speaking to. So I'm going to read this, and I'm going to read my response as well. So the viewer says, hello, what are your thoughts about a person who has been in medical coding for 3 years and transferred into risk management coding? The video is about risk adjustment coding for new medical coders, okay? And they asked me that. They asked for risk management coding, which now you took out the adjustment part. So what do you mean risk management? Is this a good thing? Is this a bad thing? So what I said was, I don't know. Every place is different, and it depends on the person. Is this a good thing for them? Why is this a question? If the person likes it, great. If they don't, they have 3 years of experience and they can move on. What does the role entail? I don't understand the question, right? So the person says, I was just asking because in many of your videos, you stated that risk adjustment coding can stunt your growth in the industry and is better to not stay in risk adjustment for more than a year. So now I'm confused. Are you only referring to new coders that are just getting started in the coding industry? And I said, this is not confusing. I said, don't stay in risk adjustment long. That goes for anyone. Normally, I don't have to say that to people who have experience because they already know this. Why? Because as I said, you are only getting one thing that you're practicing, and that's diagnosis coding. The same thing if you're a manager and you only have diagnosis experience, you can't go very far, right? You've only done the one thing. So again, let me say this very clearly so that everybody understands me. I am speaking to new medical coders. Yes, there are veteran coders that watch my channel, and maybe they're here for advice as well. Maybe they don't know, and maybe they've only stayed in one particular specialty. Maybe they've done PT and OT only, and now they're trying to branch out and do other things. They may run into problems because PT and OT, those codes are very limited. The CPT side is very limited. And so that becomes a problem when you go out in the real world, okay? But again, that aside, when I'm speaking directly to new medical coders, I don't expect my advice to be twisted to say, well, what about somebody who's had 3 years of experience? Somebody who's had 3 years of experience can go anywhere. This should not even be a question as far as like, oh, if they want to go into risk adjustment coding. Now, if you take out the adjustment and you say risk management coding, you may be referring to a completely different thing. You may not be referring to risk adjustment coding. But again, let me say this. When you are getting into this field, there will be a lot of options out there if you open your eyes to these options, which means if you want to start an HCC because you're scared of CPT and you need a little bit more time, by all means, go right ahead. But that's not going to do you any favors if you stay in it for 3 and 4 years. You see, I'm the one who gets the emails from folks saying, hey, Blue, I've been in HCC for 4 years and I want to get out. And now I'm so scared I can't get out because everybody wants experience and I don't have anything but HCC. Well, then guess what? In a lot of these job ads, there's a lot of them that will say, if your only experience has been in HCC, this doesn't count. So somebody who's been working for 4 years is kind of like, uh-oh. Well, there's ways that you can write things down and there's ways that you can talk about your transferable skills, and hopefully you have been studying. But again, I don't have to tell new people that they need to study. They're already going to know that. Again, my messages when I'm talking to new medical coders is that you need to get in and get out. Get your experience or get what you're going to learn and go on. Because the more experience that you expose yourself to as far as coding for CPT and E&M and adding modifiers to your procedure codes, that's going to help you to be able to go anywhere. You may start in a place that is like a family practice. Well, guess what happens in family practice? You see everything. You see well woman visits. Sometimes you see well baby, depending on the area. And then you see like a lot of routine things like colds. Sometimes you see sprains and other minor injuries and things like that. So you get a variety of coding in family practice. Or maybe you started off in the ER, right? And you see a lot of things in the ER. But the ER is also giving you exposure to E&M, hopefully, E&M and procedure coding and modifier application and all those things. So people who start their careers in family practice or who start in the ER or something like that, they can use that as a springboard for going other places because now they have experience applying evaluation and management, applying modifiers on procedures and procedure coding. So that's the thing that I want you guys to focus on. Don't try to twist what I say and think that, oh, well, try to trip me up and say, oh, but you said. No, yes, I was very clear when I said I'm referring to new people. I'm not referring to somebody who's been in the same position for 3 years and it moves up to risk management, which again, I didn't know what the person was referring to. Because I've had people who write in and say, well, Blue, you don't know what you're talking about. I've been in risk adjustment coding for 3 years and I just got promoted to senior risk adjustment coder. Well, congratulations. If that's where you want to stay, then by all means, that's fantastic. Again, if you want to have that exposure that's going to be able to fill out your resume so that you can have the opportunities to code wherever you want to because you're not fearful of anything, then you're going to have much more opportunities. Your potential for your earnings is obviously going to go up because some of you are also concerned about the money right out of the gate because, of course, the school sold you on this high dollar salary. Or some of you are saying, oh, no, it doesn't pay enough. Again, where are you working? Because that always plays a part in it. If you are complaining and saying that you're not making enough money as a coder, and I ask you, where do you work? And you tell me at a doctor's office, I'm going to look at you because of the simple fact that with doctor's offices, a lot of times it is the spouse that is running the doctor's office, the medical practice, right? They don't understand about coders or coding. 99% of them do not understand what coders do. This is why I always tell my providers every time I see them, when you leave here and you go off into the big bad world and you're out there and you decide to make your own practice, or you go into practice with somebody, you better make sure that you have somebody on staff that knows about the coding, or you send your spouse to coding school so that way they can understand what's happening with the codes. Oh, Blue, hey, I'm just trying to save y'all, okay? Because there was an optometrist, something, I don't know. I can't remember anymore. Anyway, the husband, he's the doctor, he's the eye doctor, and the wife was doing all the billing. Well, the wife was found guilty of fraudulent billing. So to the federal pen she goes for 3 years, and all he got was a $300,000 fine. He's still out, and he didn't have to serve any time in prison because he's a doctor and he's out there serving the people, and she's in there serving time because she wanted to do things the way that she wanted to do it. Did she have any coding education? Likely not. But again, people who run small private practices, they're going to try to get labor for as cheap as possible because they want to keep their costs low, not knowing that a good, valuable coder is going to take money to be able to have in order to be able to make sure that they are, billing accurately and that their coding is coming out good. So anyway, but if you're working for a private doctor's office and you're complaining to me that you're not making enough money, that's why. You should be applying at hospitals, because hospitals have bigger budgets. They have more money to work with. There's a little bit more mobility, and not just mobility within the department. There's abilities to be able to move up. And so there's a difference there, because once you have experience in coding, you can go on to doing other things. You can be a data analyst. You can be a clinical documentation integrity improver. You can be a physician educator. There's a lot of places that you can go once you've had the experience. And if you tell me, well, Blue, I got certified in outpatient coding and that's why I'm out here and not at the hospital. You see, you're connecting only hospital with only ICD-10 PCS, and that's not true. I work at a hospital and I work in the outpatient clinic, because there's outpatient clinics in a hospital. It's not just everybody's there and that they're inpatient, okay? There's inpatients, yes, and there's inpatient professional fee coders who code for the outpatient physician side, right? Because when you go to a doctor, you're hit with 100 bills when you get out of the hospital, right? Everybody's got their hand out. Well, one of those is a professional fee services, which is outpatient coding. But again, I did outpatient coding when I first got here. And then I went off to code for behavioral health. I coded for the TBI clinic. I coded for, where else did I code before I got to ortho? I did PT and OT. I did the pain clinic. I've been everywhere. Trust me, I've been everywhere. And they bounced me around from place to place for a while, And then, of course, I found my forever home with ortho. I got ortho and podiatry. Well, then the rheumatology clinic needed help. The pulmonary clinic needed help, or the pulmonology clinic needed help. I did neurology as well. And I did physical medicine. So there's a lot of other specialties that you can get into once you get in, because once you start, wherever you go, wherever hospital you end up at, is hopefully you're listening to my message and you're getting a job that you're going to use your skill either in coding for evaluation and management or coding for same-day surgeries. It's not as scary as you guys think it is. And I coded for same-day surgery as well. So, but you learn a lot. And if you stop being afraid of, well, I don't like to code in CPT, or I don't like to code in ICD-10 PCS, if you stop being afraid and you just get in there, there's so many more doors that can open for you. I mean, they'll just go flying open for you, but you can't get stuck in something like risk adjustment, because again, risk adjustment is only meant in my advice, okay? It's only meant in my advice that coders are there temporarily. Is it important? Absolutely. Absolutely. This data that is collected helps to save hundreds of thousands of lives every year, right? But again, it's only giving you so much knowledge and so much ability to learn things. But you are still learning, right? You're learning about the diagnosis coding. You should be well versed in pathophysiology, although it's not a requirement that it shows in the in the job listing, but it should be, right? Because you should know about pathophysiology in order to do risk adjustment coding appropriately. But again, it's not something that's enforced. Okay, so there's those things that you need to be looking at, and then adding that to your resume, and then moving on quickly. Okay, get your experience and move on. These companies out here that do a lot of these risk adjustment jobs, right? Because there's a contract company, there's a couple of them, that they're always putting out ads all the time that they need people. And what happens is a lot of them will let the people that just started right before they get to a year, they'll let them go, and they've been known to do that. They've been known to do mass layoffs, and the people are scrambling like, oh my gosh, I've only done HCC coding for a year and I don't know what to do. This is why I keep telling you guys to stay there as long as you need to get your experience, to get kind of comfortable with looking at the record and abstracting codes, pulling out those diagnosis codes, and move on. 3 months is great. 6 months is fantastic. And to me, that should be the limit. 6 months should be the limit. All right. But if you are a veteran coder, and you've been around and you've done E&M coding, you've done same-day surgery coding, you've done all this, you've worked in the ER, and you say, you know what, I just want to do something easy, I want to go to HCC, then by all means, you can do whatever it is you want to. You have the experience now. You have the experience, you have the time in, you've earned it. You've earned the right to be able to kick back for a little bit and do something that is whatever you want, whatever you're looking for. Okay. But again, like I said, my advice is specific to the people that I am addressing it to. When I'm talking to new people, don't give me a scenario and then try to turn around my words and say, oh, but you said. Yes, I'm very clear on what I said. Please do not change what I said. Okay. That's the only time I'm going to tell everybody this. Don't change what I said, because if you do, then again, what am I doing here? If you have all of the answers and you already know, then by all means, you go out and you do what you need to do. Why are you wasting time watching me? Why are you wasting time watching me if you already know the answer, right? So again, I say this, and I want you guys to be successful out there and get exposure. Do those things like you want to do. But again, I tell you guys so that you can make the most of your time. Make the most of your time, and then get into those positions that are more impactful, that are going to help you build your resume, right? And which positions would those be that will help you to build your resume? Getting into positions that is going to give you that wide exposure, coding for inpatient professional services, okay? Because that's going to make you code for everything, okay? When I coded for inpatient professional services, we coded everything. We coded mother-baby, we coded for the ICU, medical ICU, we did all of those, okay? And I coded for the NICU, I coded for behavioral health, I coded for internal medicine and ortho, and so there was a lot of variety in inpatient professional services. Again, it's the same thing in the ER. You're seeing everything, strokes, mother, baby. You're seeing all of that coming in, and you're exposed to a lot of these things. It makes for a well-rounded coder. And not only that, you get procedure coding in the ER as well. Hydration. Hydration is not the easiest thing in the world, but once you get into it, you're okay. But not before then. So try that. Family practice is another one. Urgent care is another one. These are places that are going to be much more impactful than just sitting in one specialty and not doing anything else. Okay. And people have asked me, Blue, why haven't you moved on? Because you've been in ortho. Well, y'all don't know everything, first of all. And number two, I don't just limit myself to ortho. I'm not just limited to ortho. I'm not just limited to podiatry. That's where I primarily sit, yes, obviously, but it doesn't mean that I don't help out in the ER when I'm called. It doesn't mean that I don't help out in other specialties when I'm called. It doesn't mean I don't have providers from other specialties that come knocking on my door at my office to ask me for help or ask for clarification on something. And I'm happy to help because I will research and find the answer. I don't have to code it every day to know how to find the answer for it. And you need to be that way too. Because again, it's the people who have that wide range of experience and that fearlessness to be able to go anywhere that are going to be able to have the most opportunity in this career field. And not only that, they will have the most opportunity to be able to sharpen their skills and to really love what they do. There are so many people that want to wait until they're retired. Oh, when I'm retired, I'll be happy. When I'm retired, I'll be happy. I don't have to wait till I'm retired because I'm happy now. And why am I happy now? Because I'm willing to go through the hard times of learning something new. I'm willing to go through, okay, well, I don't understand this, so I'm going to do everything I can to figure it out. Never once have I stunted myself from growing in this field. Not once. And that's what I want for you all. That's what I want for you all. So that you're not sitting here lost and not enjoying it. Because this is fun. Believe it or not. It is fun. And it's there's a lot to it. But it will come with time, you know. But again, if you don't give yourself that opportunity to learn, or you don't give yourself that opportunity to fall down so that you can get back up, you're never going to get strong. At least this is my advice anyway. So, with that said, no more twisting my words. If I'm giving you an example and I'm telling you new coders this, new coders that, don't give me a scenario where it's years down the road and somebody says, oh, well, what about this scenario? But you said. No. I don't like that at all. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.